Regions and four quadrants of the abdomen. The abdomen is divided into 9 regions by two vertical and two horizontal imaginary planes. It is divided into four quadrants by single vertical and single horizontal imaginary planes. These regions and quadrants are of clinical importance when examining and describing the pathologies related to the abdomen. Horizontal planes. The dividing planes are based on lines drawn between easily palpable bony points. The horizontal planes are of importance as they provide useful landmarks on cross sectional imaging. First horizontal line is that of the transpyloric plane. It lies at the level of the costal margin, that is, connecting the 9 costal cartilage of the right and left side with each other. The transtubercular plane corresponds to line uniting the two tubercles of iliac crests. The vertical planes are similar to each other on both sides and follow a line joining the midclavicular point to the midinguinal point. It passes just lateral to the tip of 9 costal cartilage, which is palpable as a distinct step along the costal margin. It roughly corresponds to the lateral border of rectus abdominis muscle. It is important to know the anatomical regions and quadrants of the abdomen to correlate the pain to the organs contained in each area. For example, the pain within epigastric region should guide someone to think about stomach, liver, pancreas, duodenum, and adrenal glands. Pain in the suprapubic or hypogastric region should guide someone to think about bladder, sigmoid colon, rectum, and the uterus. The right hypochondric pain prompts us to think about liver, gallbladder, right kidney, and the small intestine. In case of the left hypochondrium, think about spleen, colon, left kidney, and pancreas. The right lumbar pain indicate the involvement of the gallbladder, liver, and right colon. The left lumbar region contains descending colon and the left kidney. The appendix and cecum are in the right iliac region, and descending colon and sigmoid colon are in the left iliac region. In case of umbilical region, think about umbilicus or the navel, part of the small intestine, and duodenum. So the two vertical and two horizontal lines divide the abdomen into 9 regions clockwise from the top, and those regions include first of all epigastric region or epigastrium, left hypochondrium, left lumbar region or the left flank, left iliac fossa, suprapubic or hypogastric region, right iliac fossa, the right lumbar region or the right flank, right hypochondrium, and in the center the umbilical region. So the different structures which come clockwise on the abdomen include first of all the esophagus, stomach, duodenum, and pancreas. Then comes the spleen, the descending colon, kidneys, the ovary, adnexa, testicles, psoas muscle, skin, muscle, cecum, appendix, and ureters, and the liver and the gallbladder. The midline anatomical regions include epigastric region, umbilical region, and hypogastric regions. Each bilateral anatomical region has an associated right and left side. Adjacent to the epigastric region are the right and left hypochondric regions. Adjacent to the umbilical region are the right and left lumbar regions. On either side of the hypogastric region are the right and left iliac regions, which can be referred to as right and left inguinal regions. The abdomen can also be divided into four quadrants known as right upper, left upper, right lower, left lower quadrants. It is common to see these quadrants abbreviated as RUQ, right upper quadrant, LUQ, left lower quadrant, right lower quadrant, and left lower quadrants, means RLQ and LLQ. Here also you can see the right upper quadrant, the left upper quadrant, the right lower quadrant, and left lower quadrant. Now, why is this division done? Organization of the abdomen in this manner allows for universal communication among healthcare providers and aid in differential diagnosis. So the cause of abdominal pain can be identified by careful identification of the quadrant. So it is important to know the anatomical regions and quadrant of the abdomen to correlate the pain to the organs contained in each area. For example, pain within epigastric region should guide you to think about the stomach, liver, pancreas, duodenum, and the adrenal gland, etc. So thank you so much. That was all about the quadrants and the 9 regions of the abdomen. Subscribe on Obs and Gynae. Allah Hafiz.